Welcome to Black Docs Talk. I'm Dr. Cynthia Gu.
And I'm Dr. Sierra Talbot. I'm a maternal fetal medicine fellow.
And my name is Dr. Gini Ikwezema. I'm an OBGYN resident.
And today we're going to be talking about endometriosis. So what is endometriosis?
So endometriosis plainly is when you have cells that are normally found inside your uterus. They're found outside of your uterus in places like on your intestines or on your ovaries, and they cause pain because those cells typically would be the cells that shed during your period, and they do that outside of your uterus.
Right. Yeah, and she's totally right. And the other big thing with it is the reason that it causes pain is because a lot of your inflammatory markers that are normally found in your body tend to gravitate towards these abnormally placed cells that she mentioned.
Right. So I know we mentioned one of the symptoms being pain. So what are some other symptoms of endometriosis?
Well, one of the other things they can have is actually painful, bowel movements. They can have, pain. Sometimes it may be thought that these early on pain associated with cycles may also occur. They may also have some fullness if they have, some of these implants that have grown larger on the ovary or other areas within the pelvis.
And some items that they may have is like pain with sex, intercourse as well, and then they may just have painful cycles, but some of the pain may not even be related to your menstrual cycle.
So I know there is issues with kind of pregnancy or getting pregnant when people have endometriosis. So why do people have issues with that?
Sure. So women who have endometriosis tend to have difficulty getting pregnant or infertility issues secondary to the scarring that can occur from these cells that are not where they are. And as Gini said, they cause inflammation and they don't function as it normally should. So you can assume that these things can cause women who have difficulty to get pregnant. So, but however, we're not 100% sure what is the cause of infertility or difficulty getting pregnant with endometriosis. Women who do get pregnant with endometriosis, they are at an increased risk of having surgical complications. And the reason that this occurs is because the cells have migrated to other parts inside of the abdomen, it can form what we call adhesions or connections between the other tissues, which when someone goes in to do surgery, it makes the anatomy as we know it not look correct, and it can result in bowel injuries as well as bladder injuries and increased bleeding during, for instance, like a C-section.
The other thing too is with a history of endometriosis, there's later on in life, there's a potential risk of cancer associated with this. So you want to make sure that you continue follow-up with your obstetrician or gynecologist, and just make sure that you, if you feel abnormal symptoms, pain, you continue to check in with them just to kind of make sure that nothing else is going amiss.
And we'll also add that typically the first step for endometriosis is very conservative. So that means that they may just tell you to take over-the-counter medications. They may discuss birth control. The reason why they suggest birth control is because by suppressing your menstrual cycle, that decreases the pain because those cells that are outside of the uterus are no longer shedding like the cells would during your cycle. So having you on birth control that doesn't have a week for bleeding or potentially going on the shot or Depo-Provera are some of the first steps that are taken. But the only way to truly know if you have endometriosis is by having a surgical procedure called a laparoscopy, and that is where they put a small camera inside of your belly and actually look for these cells that we're mentioning and biopsying them. And then typically going from there, if you're having issues, despite being on conservative management, there are more advanced treatment that is available.
Yeah, it's totally correct. And so the other thing is that even though laparoscopy is the gold standard, sometimes we may not see anything when we do a laparoscopy procedure. So don't be discouraged if you're still having pain symptoms. That's why it's important for you to be persistent and make sure you seek out your GYN specialist so that they can kind of continue to monitor your symptoms and refer you to other physicians that can try different things so that they can get to the bottom of what the condition is. It may not be a quick diagnosis, it may take some time, but just be persistent.
So it's kind of common within the Black community that we're kind of undertreated for things, I would say. So why do you think that is?
I think the reason that women are undertreated, especially with endometriosis in the Black community, is there are myths that, one, they think that endometriosis is rare in the African American community, so they're most likely to put other diagnoses before endometriosis. One, the common perception is that African Americans or Black people feel less pain than our white counterparts, which we all know that's physiologically not true. Three, they think that we're more likely to have pelvic inflammatory disease, and that's just a big word to say that we're more likely to have sexually transmitted infections that grow from just being in the vagina to other parts of the body, like the uterus and ovaries. And so all of these things are put before the diagnosis of endometriosis, and that's why you see a lot of women complaining, I'm having issues with my periods, or I'm having pain during sex, all the things we just mentioned, and they're not being treated for what they likely have, which is endometriosis.
Right. And just to add what Sierra was saying, again, we a lot of times we looked at what's called dysmenorrhea or pain during periods for a long time as normal, but as we're finding out more and more, some women that may have what we call primary dysmenorrhea in the gynecology world may actually that may be some event that may represent early startings of what we think may be endometriosis, but we're not 100% sure. Now, when it comes to pain, I think we definitely need to, as a patient, you want to advocate for yourself and understand that, first of all, if you're in pain, that's not normal and you should seek out a specialist. That may be your gynecologic specialist or your OBGYN, but more and more, there are also some individuals that subspecialize in endometriosis and have specialize in the diagnosis and treatment of endometriosis, and what's most important is you getting the answers that you need. So make sure you look up those doctors that specialize in that, or have some have particularly some interest in endometriosis, because that can be helpful in diagnosing and identifying your particular condition.
What's the typical age of onset of endometriosis?
So typically, you find it in reproductive age women, so mainly in your 20s to 40s. Now, there may be outliers like we talked about where they may start earlier or may have the presentation a little bit more later onset in their 30s. But that is the by and large, just reproductive age women is when you want to think about endometriosis, and you want to look for those symptoms that Sierra mentioned, which are, painful sex, in particularly with, deep penetration and those type of things, or painful cycles. Those are things that you want to, and pain that has been chronic for some time. Those will be clues for you to start to think and look into, okay, could this be endometriosis?
And I will just add that not everyone with endometriosis actually has symptoms. So endometriosis could be found incidentally. For instance, if someone has a procedure where they look in the abdomen and they see these cells elsewhere. And there are also some atypical or not unusual symptoms that can happen too, like they have blood in their stools, blood in their urine, because these cells have attached to their bowel or bladder. So yes, those are the common things we talk about: pain during their periods or like pain during sex, but there could be some unusual presentations as well.
Absolutely. And even there has been some data and literature that has mentioned endometrial glands that are noted on the diaphragm. In that case, there may be a whole team that is needed to address the issue.
We really didn't get into like the nitty-gritty of things that can treat endometriosis or make it more tolerable for the person who has it to live a comfortable life and perform their daily activities. But what I will say is that if you find that you are not being adequately treated with some of the basic things, and basic things mean like pain medications, that's your NSAIDs over the counter, or a lot of women are put in what they call suppressive medications. So those are your birth control pills or the shot, also known as Depo-Provera. That there are definitely other options, including surgery, that can be done. And there's a whole algorithm of things that can be done to help improve your endometriosis.
Right. And it doesn't mean that your symptoms may go away, but the most important thing is potentially getting the diagnosis and getting the help you need to make your symptoms more tolerable, like Sierra mentioned.
And we want to empower you to be able to speak up about how you feel, be able to express that you feel like you're inadequately treated, and also seek second opinions if you feel that your doctor is not adequately addressing your concerns that you bring up.
I think that's very, very important to make sure that you know that you are able to seek second opinions. If you don't feel like you're being heard, like you could reach out to another physician who could give you more advice on how to deal with some of the issues that you're going through. Well, thank you guys for watching. Thank you for coming and talking to us. Thank you, Dr. Gainey, for being here. We'll catch you guys on our next video of Black Docs Talk. Catch us on YouTube and Facebook and Instagram at Young Black Physicians, and we'll see you guys next time. Bye.